Everything you need to know about gestational diabetes. What is gestational diabetes? During pregnancy, some women develop high blood sugar levels. This condition is known as gestational diabetes mellitus, GDM, or gestational diabetes. Gestational diabetes typically develops between the 24th and 28th weeks of pregnancy. According to the Centers for Disease Control and Prevention, it's estimated to occur in 2 to 10% of pregnancies in the United States. If you develop gestational diabetes while you're pregnant, it doesn't mean that you had diabetes before your pregnancy or will have it afterward. But gestational diabetes does raise your risk of developing type 2 diabetes in the future. If poorly managed, it can also raise your child's risk of developing diabetes and increase the risk of complications for you and your baby during pregnancy and delivery. What are the symptoms of gestational diabetes? It's rare for gestational diabetes to cause symptoms. If you do experience symptoms, they'll likely be mild. They may include fatigue, blurred vision, excessive thirst, excessive need to urinate, snoring. What causes gestational diabetes? The exact cause of gestational diabetes is unknown, but hormones likely play a role. When you're pregnant, your body produces larger amounts of some hormones, including human placental lactogen, HPL, hormones that increase insulin resistance. These hormones affect your placenta and help sustain your pregnancy. Over time, the amount of these hormones in your body increases. They may start to make your body resistant to insulin, the hormone that regulates your blood sugar. Insulin helps move glucose out of your blood into your cells, where it's used for energy. In pregnancy, your body naturally becomes slightly insulin resistant, so that more glucose is available in your bloodstream to be passed to the baby. If the insulin resistance becomes too strong, your blood glucose levels may rise abnormally. This can cause gestational diabetes. Who is at risk for gestational diabetes? You're at a higher risk of developing gestational diabetes if you are over the age of 25, have high blood pressure, have a family history of diabetes, were overweight before you became pregnant, gain a larger than normal amount of weight while you're pregnant, are expecting multiple babies, have previously given birth to a baby weighing more than 9 pounds, have had gestational diabetes in the past, have had an unexplained miscarriage or stillbirth, have been on glucocorticoids, have polycystic ovary syndrome, PCOS, acanthosis nigricans, or other conditions that are associated with insulin resistance, have African, Native American, Asian, Pacific Islander, or Hispanic ancestry. How is gestational diabetes diagnosed? The American Diabetes Association, ADA, encourages doctors to routinely screen pregnant women for signs of gestational diabetes. If you have no known history of diabetes and normal blood sugar levels at the beginning of your pregnancy, your doctor will likely screen you for gestational diabetes when you're 24 to 28 weeks pregnant. Glucose challenge test. Some doctors may begin with a glucose challenge test. No preparation is needed for this test. You'll drink a glucose solution. After 1 hour, you'll receive a blood test. If your blood sugar level is high, your doctor may perform a 3-hour oral glucose tolerance test. This is considered two-step testing. Some doctors skip the glucose challenge test altogether and only perform a 2-hour glucose tolerance test. This is considered one-step testing. One-step test. 1. Your doctor will start by testing your fasting blood sugar levels. 2. They'll ask you to drink a solution containing 75 grams g of carbohydrates. 3. They'll test your blood sugar levels again after 1 hour and 2 hours. They'll likely diagnose you with gestational diabetes if you have any of the following blood sugar values. Fasting blood sugar level greater than or equal to 92 mg per deciliter, milligram per deciliter. 1 hour blood sugar level greater than or equal to 180 mg per deciliter. 2 hour blood sugar level greater than or equal to 153 mg per deciliter. Two-step test. 1. For the two-step test, you will not need to be fasting. 2. They'll ask you to drink a solution containing 50 grams of sugar. 3. They'll test your blood sugar after 1 hour. If at that point your blood sugar level is greater than or equal to 130 mg per deciliter or 140 mg per deciliter, they'll conduct a second follow-up test on a different day. The threshold for determining this is decided by your doctor. 1. During the second test, your doctor will start by testing your fasting blood sugar level. 2. They'll ask you to drink a solution with 100 grams of sugar in it. 3. They'll test your blood sugar 1, 2, and 3 hours later. They'll likely diagnose you with gestational diabetes if you have at least 2 of the following values. Fasting blood sugar level greater than or equal to 95 mg per deciliter or 105 mg per deciliter. 1 hour blood sugar level greater than or equal to 180 mg per deciliter or 190 mg per deciliter. 2 hour blood sugar level greater than or equal to 155 mg per deciliter or 165 mg per deciliter. 3 hour blood sugar level greater than or equal to 140 mg per deciliter or 145 mg per deciliter. Should I be concerned about type 2 diabetes as well? The ADA also encourages doctors to screen women for type 2 diabetes at the beginning of pregnancy. If you have risk factors for type 2 diabetes, your doctor will likely test you for the condition at your first prenatal visit. These risk factors include being overweight, being sedentary, having high blood pressure, having low levels of good HDL cholesterol in your blood, having high levels of triglycerides in your blood, having a family history of diabetes, having a past history of gestational diabetes, prediabetes, or signs of insulin resistance. Having previously given birth to a baby who weighed more than 9 pounds. Being of African, Native American, Asian, Pacific Islander, or Hispanic descent. Are there different forms of gestational diabetes? Gestational diabetes is divided into 2 classes. Class A1 is used to describe gestational diabetes that can be controlled through diet alone. People with Class A2 gestational diabetes will need insulin or oral medications to control their condition. How is gestational diabetes treated? If you're diagnosed with gestational diabetes, your treatment plan will depend on your blood sugar levels throughout the day. In most cases, your doctor will advise you to test your blood sugar before and after meals, and manage your condition by eating healthy and exercising regularly. In some cases, they may also add insulin injections if needed. According to the Mayo Clinic, only 10 to 20% of women with gestational diabetes need insulin to help control their blood sugar. If your doctor encourages you to monitor your blood sugar levels, they may supply you with a special glucose monitoring device. They may also prescribe insulin injections for you until you give birth. Ask your doctor about properly timing your insulin injections in relation to your meals and exercise to avoid low blood sugar. Your doctor can also tell you what to do if your blood sugar levels fall too low or are consistently higher than they should be. What should I eat if I have gestational diabetes? A balanced diet is key to properly managing gestational diabetes. In particular, women with gestational diabetes should pay special attention to their carbohydrate, protein, and fat intake. Eating regularly, as often as every 2 hours, can also help you to control your blood sugar levels. Carbohydrates. Properly spacing out carbohydrate-rich foods will help to prevent blood sugar spikes. Your doctor will help you determine exactly how many carbohydrates you should eat each day. They may also recommend that you see a registered dietitian to help with meal plans. Healthy carbohydrate choices include whole grains, brown rice, beans, peas, lentils, and other legumes, starchy vegetables, low-sugar fruits. Protein. Pregnant women should eat 2 to 3 servings of protein each day. Good sources of protein include lean meats and poultry, fish, and tofu. Fat. Healthy fats to incorporate into your diet include unsalted nuts, seeds, olive oil, and avocado. What complications are associated with gestational diabetes? If your gestational diabetes is poorly managed, your blood sugar levels may remain higher than they should be throughout your pregnancy. This can lead to complications and affect the health of your child. For example, when your baby is born, he or she may have a high birth weight, breathing difficulties, low blood sugar, shoulder dystocia, which causes their shoulders to get stuck in the birth canal during labor. They may also be at higher risk of developing diabetes later in life. That's why it's so important to take steps to manage your gestational diabetes by following your doctor's recommended treatment plan. What is the outlook for gestational diabetes? Your blood sugar should return to normal after you give birth. But developing gestational diabetes raises your risk of type 2 diabetes later in life. Ask your doctor how you can lower your risk of developing these conditions and associated complications. Can gestational diabetes be prevented? It's not possible to prevent gestational diabetes entirely. However, adopting healthy habits can reduce your chances of developing the condition. If you're pregnant and have one of the risk factors for gestational diabetes, try to eat a healthy diet and get regular exercise. Even light activity, such as walking, may be beneficial. If you're planning to become pregnant in the near future and you're overweight, one of the best things you can do is work with your doctor to lose weight. Even losing a small amount of weight can help you reduce your risk of gestational diabetes.